Mr. Chairman. My name is Mark Guimond. I'm the Director of State Legislative Affairs for the Arthritis Foundation. And here on behalf of the 50 million people in this country with doctor-diagnosed arthritis and the 100,000 residents of the district who have this chronic debilitating disease. We strongly support the Specialty Drug Copayment Limitation Act of 2015. We believe this bill is important because it's going to increase access to life-changing medications. If you know somebody with chronic rheumatoid arthritis or other forms of arthritis, it can change lives. It can keep people from being with their families, from working, from walking, from having a job. And the specialty medications that we're talking about in this particular bill, I think are best referenced. I have given this to the committee. But a representation of what children were like a generation ago before biologics and where they are today. It increases the quality of life significantly. And people need to have access to these medications. And a lot of these folks that need not just one, but 2 or 3 different specialty medications based on comorbidities. And a lot of these medications, they're not something you go down to your corner drugstore and get a pill. In the rheumatoid arthritis space, 100% of the biologics are either IV infused or self-injected. These are not just generic medications. You can't just go out and find a cheaper medication. But going without them means you could have joint damage, blindness, even death. They're critical medications that people need to have on a regular basis. Our primary consideration here today for the bill is what we call the January effect. And that is where somebody's plan year ends for 1 year and begins for the next year. And then they face their full deductible. And they have to meet that deductible before they can get to their medications. So depending on how high that deductible is, they may have to come up with essentially a mortgage payment or 2 or food for a month to be able to pay for their medications. In the district here, according to the Kaiser Family Foundation, the average deductible for somebody, a covered worker for a large firm, is about $1,300 a year. That means that person has to have $1,300 on the first day of their plan year to afford their medications, or they don't get their medications. As we see the $150 a month payment under the bill as proposed, it would come out to about $1,800 a year. So instead of having it all at once at the beginning of the year, that $1,800 that would be required would be spread out over the course of the entire year. And we think that's fair and equitable. If the insurers are receiving their full deductible in that payment plan, they're not losing a dime. So we're not sure where the opposition would be to that. But we think it's critical, particularly to working families, those that are trying to make ends meet and struggling when they have to hit that January effect and they simply don't have the money that they need. If they could spread it out over the course of a year a little more equitably, we believe that people would have more access to their medications and therefore have greater adherence to their medications. I would add, too, that the bill does not apply to Medicare and Medicaid, in case anybody was questioning about that. Thank you.